Madam President, the Assembly has gathered. Let the celebrations begin.
Good morning. To the graduating class, fellow members of the platform party, faculty, staff, trustees, parents, family, and friends, it's my honor to welcome you here on this very, very special occasion. Today is a day of joy and celebration and accomplishment. I offer my heartfelt congratulations to you, our graduating class of 2019. Before we get started, this is also a special day for many people in the audience. Today is Mother's Day. And I'd like to ask the class to stand up, find the person that you love as your mother, and say thank you. Everybody up. Well done, well done. We will begin our program with the national anthem by Jimmy Charlotte Hahn, accompanied by Mark Vickers and Eric Zeiser. Following the national anthem, the invocation will be delivered by Reverend Nancy Kingwood. I ask you to please rise now and to remain standing.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets ring clear, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the brave and the home of the brave?
Let us pray. All-wise, eternal God, we thank you, God, for this day, because this is the day that you have made, and we are glad and we are rejoicing in it. God, we thank you for every graduate here and their families. We thank you, God, for their sacrifices. God, we ask you now that you allow your spirit to rest in this place today and forevermore. God, we ask you to open doors that they don't even see. We ask you, oh God, right now, God, that you would allow them to leave their corner of the world better in which they found it. We ask these things in your name. Amen.
Please be seated. On behalf of the faculty and the trustees of the University of Bridgeport, it's my honor to congratulate you on your graduation from the College of Health Sciences. Today you graduate with classmates from both near and far. Wherever you call home, we hope you have found a second home here at what will become your alma mater at the University of Bridgeport. We hope that you are always part of our community and our family here. For the class of 2019, here's a little bit about all of you. 77% of you are female. 19% are the first in your families to go to college. Graduates of color are 19% of our class. You come from 27 states, as far away as Montana, Washington, Oregon, Georgia, Texas, and Florida, or as close to us as Bridgeport, Milford, or Fairfield. 3 of our graduates call Canada, China, and Spain home. Several graduates in our program are following their parents' footsteps, as they too are graduates of the University of Bridgeport. And while many of you came with dreams and career plans well in place, you started to think about where you wanted your future path to lead you, and you came back to continue your education. Many of you have juggled the demands of school with a full-time job, family, children, elderly parents, grandparents, or any of the other stars in the vast constellation of possibilities we encounter in our lives. You are caregivers, and you have sacrificed yourself for the sake of others. You indeed have worked hard to make it to this graduation day, and this ceremony marks the passage of one chapter of your life into the next. I deeply believe that education starts with a dialogue between the student and the faculty member. Your professors have served as mentors, coaches, and advisors. They've probably pushed you at times, past parts that you thought maybe you couldn't achieve, but you did because of their guidance. They care about you as a student and a person, helping to pave the way for you so you can enjoy personal growth and future career success. Wherever life may take you, continue to seek out those who are supportive of you, who believe in you, and who know and believe that you can make an impact, not just in your life, but in the lives of others. Your time at the University of Bridgeport has prepared you well to face the ever-evolving challenges that are being addressed by our healthcare system today. You learned a great deal about the structure and function of the human body, the fundamental science upon which a diagnosis is based, and the all-important humanistic qualities that come with the very best kind of care. I like to study Mark Twain, and one of the pieces of advice that he gave to a student was this: keep away from people who try to belittle your ambitions. Small people always do that, but the really great make you feel that you too can become great. I believe, and so do all of the faculty who join me here today, that you are all great. And because you have such enormous talent, we expect great things from you. Each of you has worked hard to reach this milestone. You not only have the tools, you have the intelligence and the heart. Congratulations, and enjoy this special day. I now call on Dean Carol Papp to introduce our commencement speaker.
Thank you, President Trombley. Today, it's indeed my pleasure and honor to introduce Dr. Tracy Gaudet, Executive Director, National Office for Patient-Centered Care and Cultural Transformation of the Veterans Health Administration, as our commencement speaker. Dr. Gaudet holds a primary academic appointment in the Veterans Health Administration, Department of Obstetrics and Gynecology, as an adjunct assistant professor. I encourage you to read her full biography in your program. Let me share a little more with you about Dr. Gaudet. She was featured on the public broadcasting system nationally acclaimed special entitled The New Medicine, and named by Shape magazine as one of 11 women who shaped the world. In July of 2011, Dr. Gaudet was recognized as one of the top 25 women in healthcare in 2011 by Modern Healthcare. In October 13, she was featured as the game changer in Fortune magazine. Dr. Gaudet is also the author of Consciously Female, a book on integrative medicine and women's health and body, soul, and baby. It is my pleasure and honor to present to you Dr. Tracy Gaudet.
Thank you so much, and thank you, President Trombley and Dean Papp, and Good morning, everyone. It's really exciting to be here. It's truly an honor to join you today and to be addressing the graduates as well as their friends and family, so thank you for having me. I wanted to start by just reflecting on the fact that graduation marks not only a significant accomplishment, but it's a significant happening in your life and in the lives of those who love you and support you. And sometimes, I once had a friend who said, you know, I had that event, whatever it was, but I missed the experience. And what does that mean, right? Sometimes we're in such an excited state that the day flies by, the events fly by, and then it's done. So I'd actually like to start my comments with a little bit of acknowledgement and offer and request that you all take just a moment. You got here, you're dressed, you're looking awesome, your family's here. Just take a moment to breathe. Just take a pause, if you will, before we continue with all of the festivities and important elements of this tradition. Take a breath. If you're comfortable, close your eyes. And just allow yourself to be in this moment. Allow yourself to feel all of your senses. Imprint anything you're hearing, any smells, any sounds. Most importantly, take a moment and imprint how it feels. Whether you're graduating, whether you're faculty, whether you're friends and family, just take a moment and imprint that in your heart. And then as you're comfortable, bring your attention back. And I'd like to start the context of my comments today by just saying a few words about the state of health and well-being in America. All right, and I think I don't need to tell you all that the bottom line here is that it is in a full-blown crisis. We spend more in America, exponentially more in healthcare than any other nation on the entire globe, and yet our outcomes are really not that good. We're 37th in life expectancy, right next to Cuba, I believe. We have an opioid crisis. We have an obesity epidemic. The list goes on and on and on. And the bottom line is both the health outcomes and the costs are crippling this nation. Now, that's pretty bleak, but the good news about crisis is it calls for transformation. So there is no lack of people and leaders across the nation saying healthcare has got to change. But I'm telling you, we're not doing such a good job yet of really transforming it. You know, our conversation so far by mainstream healthcare, the words are right. We're talking about, we need to be more proactive about people's health and well-being. We need to really focus not only on managing and diagnosing disease, but optimizing health and well-being. So the concepts are out there, and they're now shared nationally. Everyone is calling for that transformation in healthcare. But we're not doing a very good job of actually changing it, right? The metaphor I like to use is that we're serving the same main course, like the plate's there, the food is in the center, and then we're going, that's not working very well. So we're adding a few garnishes around the outside of the plate, a little acupuncture, a little nutrition, but we haven't really changed the main course of healthcare. And it's really time to do it because that other plan isn't working. So what's really needed? What's really needed is a radically re-envisioning what healthcare actually is, and then redesigning how we deliver it. So what does that look like? Well, fundamentally, there's a real paradigm shift here, right? We have to shift from the way I was trained as an MD to only focus on finding and fixing disease in a reactive way. You have a problem, you come in, now I'm going to try to help fix that, to a proactive approach. And it's interesting, actually, when you learn about the dominant paradigm in healthcare and where it came from. It was way back in the late 1800s. We started making scientific discoveries like the germ theory, and that helped people understand and believe at that time that most disease was caused by a single agent. And if we could only figure out the cause for all diseases, then we could fix the remedy. And our language tells us that paradigm is true, right? The language, think about it. You have hypertension, I can give you an antihypertensive. Depression, antidepressant, right? You think of an infection, an antibiotic. So that you can see the paradigm was, you have a problem, the healthcare system should remedy that, fix it, cure it. And way back when I was in med school, we actually believed it was only a matter of time till there was enough science and enough discovery that we understood the causes of diseases and we could cure them. Well, now, fast forward, we know it's not that simple, right? We know, I mean, even the science is advanced. We have systems biology and quantum physics, and we understand that human beings are complex adaptive systems with souls, in my opinion. And it's not so easy to just say, oh, that's your problem, here's your anti-problem. Doesn't fix it. It calls for an entirely new approach and a new way to even think about healthcare in this country. And really, you know, mainstream medicine is in its infancy here. It's like mainstream medicine forgot that the human body and soul have an innate capacity to heal. If you talk to kids and they cut their hand, they are amazed by what happens as they watch that cut heal over the next couple of days. And it is amazing, but we've kind of forgotten. It's amazing that you can break a bone, and if it's in alignment, do nothing, it heals. The innate capacity to heal is huge, even at a molecular level. DNA and RNA, I mean, it's amazing how intricate and sophisticated the mechanisms are for finding errors. They run up and down those RNA strands and they find errors in the coding. And then another enzyme comes in and cuts it out, and another one comes in and replaces it with the right sequence. It's amazing, the capacity to heal. But mainstream medicine has kind of pushed that aside. We're making a little progress. The example I like to use is that last year, the Nobel Prize was awarded to James Allison and to Suku Honjo. Both men were working in a paradigm shift in cancer treatment, and that's why they won the Nobel Prize. It was the paradigm shift piece of their work. So as described, most cancer approaches are focusing at the fighting the cancer cells, so either with chemo or radiation. That's the paradigm. Both of their work shifted that paradigm and is looking at really innovative cancer treatments that actually boost and support the immune system that is innate to the human being and allow the immune system to better fight the cancer. I mean, that's a big paradigm shift. So this concept of enhancing the body's innate capacity to heal is truly groundbreaking in mainstream medicine, but not to you all, right? This is the basis of each of your professions. So what is the real solution to the healthcare crisis facing America? You all are. I mean that so sincerely. You all are the answer. The healthcare of the future, and it is in place in a lot of systems around the nation. It's just not yet the dominant paradigm, but it is happening. This isn't like a fantasy, 100 years from now. It is happening now. In that new healthcare system, self-care is the new primary care. So think about that. Self-care is the new primary care. The first thing isn't to run off and have the clinician diagnose and treat. Clinical care will always be important. It's not that it's not important. It's not that it's not a piece of the healthcare system of the future, but it's not the centerpiece, which is pretty cool. Self-care is at the center. And how do we support people in their self-care? We need healthcare professionals who understand how to empower and equip people to take charge of their life and their health. That means helping them in motivation to even take it on. It means giving them new tools and new skills to address their health and well-being, and then supporting them across time. The current system of healthcare delivery is just not designed to do that. It's not that those of us trained in that mainstream model, like myself, are not good people and not compassionate people wanting to do the right thing. We are, but the system is not designed for that. It's all changing now. And if I were graduating today, and what I want you to know is I don't think there's any better time for you to be graduating and leading this nation. Because what healthcare professionals are trained to do that model of care that I just talked about, I'll tell you who are, the graduates of the Acupuncture Institute. You can shout out if you are a graduate or a family member of the Acupuncture Institute. You got anybody out there? All right. I'm like, okay, all right, wild applause. Graduates of the School of Chiropractic. Graduates of the Phone School of Dental Hygiene. Graduates of the School of Naturopathic Medicine. Graduates of the Nutrition Institute. Graduates of the Physician Assistant Institute. And graduates of the School of Health Professions. That is who is trained to do this. You all will lead the transformation of healthcare and well-being in this country. You know, as a physician, I was trained to diagnose and treat diseases of the body and the mind. But I think we all know that it is the heart and the soul that are the doorways for the healing of the body and the mind. You all are trained in these approaches. You are ready. Do what you were trained to do and what you know how to do. You will touch lives and you will touch hearts. You will help people find healing. And in so doing, you will change the world. We all thank you and congratulations.
Will the degree candidates please stand? By the authority vested in me by the Board of Trustees of the University of Bridgeport and the Office of Higher Education in Connecticut, I confer upon you the degrees for which you have been presented with all rights, privileges, honors, and responsibilities thereto appertaining. Congratulations to the class of 2019.
Congratulations all. The graduates will now be recognized individually and will approach the stage to be hooded by their program director, as their name is called by a program representative. Students receiving combined degrees will be hooded when receiving their doctoral degree. Each of our institutes and schools, through their respective directors and program representatives, will administer their oaths after the graduates are gathered in front of the stage, facing the audience after having been hooded. Students and oath administrators will recite their oaths together. The oath ceremony marks an important time for those entering the field of healthcare, during which graduates acknowledge their role in the welfare of their patients and communities. At the successful conclusion of a course of study, the university certifies students by awarding academic degrees. In addition, it is the tradition in many healthcare fields to also administer an oath. The medical oath is one of the oldest binding documents in history. Written in antiquity, its principles are held sacred by healthcare providers of all kinds to this day: to treat the sick to the best of one's ability, preserve patient privacy, and to teach the principles of good health care to the next generations of practitioners. Nearly 100% of U.S. medical schools requiring graduating practitioners to swear such an oath. These oaths serve to both bring cohesiveness to healthcare traditions through the years and to help guide new practitioners learning to navigate the ethical principles of healthcare and the realities of a changing healthcare landscape in a world that has witnessed huge scientific, economic, political, and social changes. You may choose to follow along as all the oaths are printed in the program. I now call upon Director Jennifer Brett to present the degree candidates from the Acupuncture Institute. I also call on Associate Director Charles Ford, who will announce the names of the graduates.
Will the candidates for the master's and doctoral degrees in traditional Chinese medicine please come forward and be recognized? Madam President, I present the degree candidates from the Acupuncture Institute.
Susan First Knight. Da Drunla Moore. Dr. Alix Pose Sussman. Dr. Marissa Hauser. Mozart Paiva. Dr. Monir Kokandi.
I will now administer the acupuncturist oath. Candidates for the acupuncture degrees, please face the audience and raise your right hand. We'll recite the oath together. I solemnly promise to practice the profession of acupuncture and traditional Chinese medicine, to utilize the methods of diagnosis and treatment as taught by my teachers, and to apply the methods of treatment which, according to my best judgment, I consider beneficial to the health of my patients. I will honor my instructors and all who have developed and preserved the knowledge and art of traditional Chinese medicine. I will strive to further my understanding of health and pass on this knowledge to others. I will conduct my practice with integrity and free from prejudice. I will at all times treat my patients with dignity and keep confidential all things revealed to me as a practitioner of the healing arts. Before this gathering of witnesses, I hereby affirm that I will remain true to this oath. Congratulations.
Turn to your seats. I now call upon Director David Brady and Associate Director Kara Seclair to present the degree candidates from the Nutrition Institute. I also call on Assistant Director Linda Fleming, who will announce the names of the graduates.
Will the candidates for the MS degree in nutrition please come forward and be recognized? Madam President, I present the degree candidates from the Nutrition Institute.
Jacqueline Brown. Mahila Kensimi. Mallory Hazen. Karen Holland. Danielle Jascott. Dr. Amanda Gomez. Gabrielle Lewis. Antoinette Liviola. Lee Anna May. Erin Metz. Cheryl Prentice. Catherine Snyder.
Associate Director Karen Seclair to administer the nutritionist oath.
Candidates for the Masters in Human Nutrition degree, please face the audience, raise your right hand. Loud and proud, we will recite the nutritionist oath together. I dedicate myself to the service of all people as a practitioner of the art and science of clinical nutrition. I will honor my instructors and the knowledge they have imparted to me and dedicate myself to assisting and encouraging others to strengthen their health and reduce risks for disease, utilizing the inherent power of food and nutrition, and to teach the principles of healthy nutrition and preventive health care. I will conduct my practice of nutrition with integrity and freedom from prejudice. I will act responsibly and work within my legal scope of practice and professionally refer clients who may require medical support and treatment to licensed physicians. I will show respect for all colleagues in the healthcare profession in my work and deeds. I will listen to the needs of those I service and will keep confidential whatever I am privileged to witness. I will share my knowledge and growth with my colleagues with an open mind and heart. Before this gathering of witnesses, as a master of human nutrition, I pledge to remain true to this oath.
Congratulations, and thank you, Ms. Sinclair. Candidates, please return to your seats. I now call upon Interim Director Lauren Weindling and Medea Snovilazzi, Clinical Education Coordinator, present the degree candidates from the Physician Assistant Institute. I also call on Carolyn McCann, Program Assessment Coordinator, who will announce the names of the graduates.
Will the candidates for the MS degree please come forward and be recognized? Madam President, I present the degree candidates from the Physician Assistant Institute.
Natasha Amara. Dimiana Atta. Vance Bauman. Stephen Bayer. Vincent Cadella. Shayna Castagna. Nikki Cody. Courtney Chorney. Trevor Doherty. Shannon Draper. Sarah Garceau. Daniel Hobson. Megan Hughes. Jacqueline Hines. Brittany Johnson. Hannah Johnson. Ala Capustina. Brianna Kometz-Fitcher. Raymond Krieger. Mary Kate Kubler. Daniel Lee. Katie Mataska. Anthony Mucciante. Alexander Olson. Payal Patel. Rebecca Pritchard. William Rummel. Trevor Segis. Audra Sarna. Lindsay Schrader. Theodore Simos. Stephen Struthers. Brooke Vasilescu. Marissa Weeks. Chloe Wilson. Kelsey Wilson. Samantha Wendelowski.
I now call upon Ms. Sarah Wallace to administer the physician assistant oath.
Candidates for the Master's in Physician Assistant degree, please face the audience and raise your right hand. We will recite the physician assistant oath together. As a graduate of the University of Bridgeport Physician Assistant Institute, I respectfully pledge the following with honesty and devotion. As a practitioner of medicine, I understand the limits of my knowledge and experience, and therefore commit to the expansion of my knowledge, skills, and abilities. I will share and continue to magnify my craft and my role. I will acknowledge error by my hand or another and work towards remedy for the good of my patients. I will cherish, promote, and respect the value of diversity in my patients, peers, and community. As a practitioner of medicine, I will emphasize individual attention for the well-being of all patients, always striving to treat each patient as a whole being. I will uphold the ethical principles of autonomy, beneficence, to do no harm, and to hold confidential the information provided in trust. I will be fair in my judgment and treatment of my patients. I will be a role model to my patients and engage in health promotion. I will honor my faculty and represent the university, being professional, knowledgeable, and kind. As a physician assistant, the promise I make today is to my patients, colleagues, and family. Adjuvari, Mederi, Communiter, to help, to heal together.
Congratulations and thank you, Ms. Wallace. Candidates, please return to your seats. I now call upon Director Marsha Lorenzen and Coordinator Wendy Garcia to present the degree candidates from the Fones School of Dental Hygiene. I also call upon Assistant Professor Jody Bishop-Pullen, who will announce the names of the graduates.
Will the candidates for the MS degree please come forward to be recognized? Madam President, I present the degree candidates from the Fones School of Dental Hygiene.
Elizabeth Acevedo. Mary Burley. Kavneet Bhatti. Lauren Durrell. Samin Fazeli. Fallon Gordon. Christine Griffin. Danielle Harrison. Hannah Chan. Bernadette McCauley. Amanda Sargent. Heidi Spangler. Kwajalein Washington.
That little graceful step. I now call upon Adjunct Assistant Professor Christine Hempowitz to administer the dental hygienist oath.
Will the candidates for the Master's in Dental Hygiene degree please face the audience, raise your right hand. You will recite the dental hygienist oath together.
Please join me. As a graduate-level dental hygienist, I affirm to promote professional advancement and lifelong learning to advance the dental hygiene profession through anticipating, assessing, and analyzing emerging trends and initiatives, participating in collaborative leadership and mentorship activities in academia and community outreach, and applying current evidence-based knowledge to design and evaluate effective and efficient approaches to the methodology of dental hygiene education, public health, and the patients entrusted to our care.
Congratulations and thank you, Dr. Hempowitz. Candidates, please return to your seats. I now call upon Director Albert Grazia and Associate Director Oscar Coetzee to present the degree candidates from the School of Health Professions. I also call on Dr. Michael Chalfie, who will announce the names of the graduates.
Will the candidates for the Doctor of Health Sciences degree please come forward and be recognized? Madam President, I present the degree candidates from the School of Health Professions.
Dr. Talene Kasky. Dr. Grace Catala. Dr. Kimberly Robinson. Dr. Claudio Villarroel.
Congratulations and thank you, Dr. Grazia and Dr. Coetzee. I now call upon Director Michael Chalfie and Associate Director Paul Sherman to present the degree candidates for the School of Chiropractic. I also call on I also call on Associate Director Anthony Honorato, who will announce the names of the graduates.
Will the candidates for the DC degree please come forward and be recognized? Madam President, I present the degree candidates from the School of Chiropractic.
Dr. Andrew Bambrick. Dr. Danielle Botello. Dr. David Brito. Dr. Hannah Ray Brucker. Dr. Joel Shalot. Dr. Jonathan Charleston. Dr. Alex Krellin. Dr. Eric Fresina Dio. Dr. Julian Galicchio. Dr. Daniel Giveisman. Dr. Michael Gonzalez. Dr. Kaylee Heath. Dr. Dylan Kennel. Dr. Eric Kuzo. Dr. Joshua R. Lancelotti. Dr. Kevin Lenahan. Dr. Phoebe Lee Yu. Dr. Dean Maturo. Dr. Kenna McDermott. Dr. Bhumi Patel. Dr. Yuno Shin. Dr. Tayaba Sultan. Dr. Caitlin Termel. Dr. Tyler Van Steenbergen. Dr. Brittany Lene Weinsoff. Dr. Lauren Zolnowski.
I now call upon Associate Professor of Clinical Sciences, Dr. Emmett Hughes, to administer the chiropractic oath. Dr. Hughes?
Candidates for the Doctor of Chiropractic degree, please face the audience, raise your right hand, and repeat the chiropractic oath along with me. I do hereby affirm before God and these assembled witnesses that I will keep this oath and stipulation to hold in esteem and respect those who taught me the chiropractic healing art, to follow the methods of treatment which according to my ability and judgment I consider for the benefit of my patients, to abstain from whatever is deleterious and mischievous, to stand ready at all times to serve my fellow man without distinction of race, creed, or color. With purity, I will pass my life and practice my art. I will at all times consider the patients under my care as of supreme importance. I will not spare myself in rendering them help, which I have been taught to give by my alma mater. I will keep inviolate all things revealed to me as a physician. While I continue to keep this oath unviolated, may it be granted to me to enjoy life and the practice of the chiropractic healing art, respected by all people at all times. Congratulations.
Congratulations, and thank you, Dr. Hughes. Candidates, please return to your seats. I now call upon Director Marsha Penguber and Associate Director Jose Mahoud to present the degree candidates for the School of Naturopathic Medicine. I also call on Assistant Professor of Clinical Sciences, Kimberly Sanders, who will announce the names of the graduates.
Will the candidates for the naturopathic doctoral degree please come forward and be recognized? Madam President, I present the degree candidates from the School of Naturopathic Medicine.
Dr. Angel Abraham. Dr. Jenna Baki. Dr. Darissa Espinal. Dr. Amanda Gomes. Dr. Marisa Hauser. Dr. Anna Johnson. Dr. Noreen Kelly. Dr. Michael Kolotinsky. Dr. Lindsay Marr. Dr. Joseph Marcello. Dr. Teresa Masano. Dr. Elisheva Neffinger. Dr. Samantha Pryor. Dr. Far Rahman. Dr. Vanessa Rugele Sepulveda. Dr. Mostafa Tahiri. Dr. Mansi N. Vera. Dr. Carolina Zagaya. Dr. Ashlyn Zickmund.
I now call upon Clinical Assistant Professor Cynthia Anderson to administer the Naturopathic Physician's Oath.
Candidates for the Doctor of Naturopathic Medicine degree, please face the audience, raise your right hand, and repeat the naturopathic physician oath along with me. I dedicate myself to the service of humanity as a practitioner of the art and science of naturopathic medicine. By precept, education, and example, I will assist and encourage others to strengthen their health, reduce risks for disease, and preserve the health of our planet for ourselves and future generations. I will continually endeavor to improve my abilities. I will conduct my life and practice of naturopathic medicine with integrity and freedom from prejudice. I will keep confident what should not be divulged. I will honor the principles of naturopathic medicine. First, to do no harm, to cooperate with the healing powers of nature, to address the fundamental causes of disease, to heal the whole person through individualized treatment, to teach the principles of healthy living and preventative medicine. With my whole heart, before these witnesses, as a doctor of naturopathic medicine, I pledge to remain true to this oath.
To the students here, and now our graduates, who are the nieces and nephews and daughters and sons, and the partners and wives and husbands, and the children of, to all of you, I can congratulate you. I wish you all the best. I hope that you will always remain connected to the University of Bridgeport, now your alma mater. On behalf of the faculty and trustees, we are so very proud of you, and we wish you all of great happiness and fortune in all of your future endeavors. And so to everyone, please, let us applaud the class of 2019. Would everyone please stand for the alma mater? And we have a reception in our art gallery as well as a reception area outside under the tent. Thank you.